Hey, it's Jason PT, and I am talking about chondromalacia patella or patellofemoral pain syndrome, a very common injury that patients have. Often has an insidious onset, no real rhyme or reason, it just starts to crop up. And I want to show you some of the mechanics that's causing this so you know where to look in order to get better, because it doesn't just happen, it doesn't just go rotten. What it really is, it's a wearing down of the cartilage on the underside of this kneecap. Okay, so the real term for it is chondromalacia, chondrocartilage malacia softening, patella, kneecap. So what's happening with chondromalacia patella is there's an increased compression and lateral force going across that kneecap, which is starting to wear down your cartilage. Now, in some videos, I call the knee the stupid joint, and I will definitely tell you that I believe it is the stupid joint. Its basic job is to go back and forth with a little bit of rotation. But it does start to create, it starts to manifest problems for other joints, most namely the hip and the ankle, which I talked about in my meniscal video. But effectively, what happens is that with a flat foot, it can start to create an increased shearing force. So you'll notice this angle, femur to shin, is what we call the Q angle, okay? That Q angle in men is a little bit shallower. It's a little bit deeper on females because you guys have wider hips than we do. That's why women have a tendency to get this a little more frequently, because you already have a larger angle, which creates that lateral shearing force. But not always. But the foot can actually create this problem, because if the foot flattens, it increases the amount of that Q angle. This is me just moving the foot and flattening that foot, and it will increase that that Q angle and cause that more lateral shearing, because it's a force vector. Okay, force vectors back in high school. Never thought you'd have to see them again. Think of this as a box. You know, force vectors. One guy pushes the box this way, the other guy pushes the box this way, and you get a resultant force. This is a box. So when you have an increased Q angle, the tendon pulls down, and your quads are pulling up. But because of the increased angle, you're going to get that increased shearing force, and then that's what's going to cause that shearing force to come across. Okay, lack of hip mobility, just like the meniscus video. With that lack of hip internal rotation that we would normally get when we go to walk, what will happen is the knee then over rotates into external rotation. The tibia goes into external rotation and it increases that Q angle, which will also start to cause problems. Okay. Now, you're probably saying, my therapist said my glutes are weak. Yes. Here's the other force factor that people don't often look at. So when I flip this all the way around, okay, you have your leg, all right? When you go to step up onto something, okay, your knee is extending, all right? So your quadriceps are contracting, and that is extending the knee this way, all right? And then you have your glutes. Your glute muscles here pull the leg back around, all right? So they're pulling, the glutes are pulling you this way, while the quadriceps are contracting and straightening. And you've probably heard the term quadricep dominant. It's because those glutes are weak. If your quads are doing too much work to then come up over a step, where it's most prominent, because people always tell me steps hurt, that quadricep is pulling here, the tendon is holding down, which also means you get an increased resultant compression force. So not only are you getting the shearing that's going laterally, you're also increasing the compression. So compression and shearing is going to start to wear down that cartilage. So yeah, you obviously have to then go strengthen the glutes. The next question though for me is, okay, you've identified this glute weakness, why is it weak? Muscles just don't go weak, they don't go kablooey. And this is where I would tell you the next step to find some of this etiology is you examine the hip and see if you have the rotation that you need, or you go up to the lumbar spine, because the lumbar spine, L5 and S1, are the ones that power those glutes. So you need to look at that, as well as the sacroiliac joint that's up here, because those are the nerves that service the glutes, and then the joint, if that's affected, it's going to start to shut down the glutes as well, because they just don't go kablooey. But that's patellofemoral pain syndrome. This is really just the manifestation of those other problems, and this is where, because it's a more susceptible joint, where things are going to start to wear down. So that's chondromalacia patella. That's what I would say go look at. Obviously do some stuff to the knee. You can try taping it. To be honest though, it's a physics problem. Your body weight going up and down on a step, just, you know, you can do it, but I mean, I don't think it really is doing much. But yeah, chondromalacia patella. So yeah, follow me here on TikTok. You can follow me at www.jasonthept.com and listen to my podcast, Around the Treatment Table with Jason the PT, and hit those likes and subscribe buttons wherever they may be, and I'll see you at the next video. Thanks a lot.